Our next speaker is Benjamin Domenech. Is a research fellow for the Heartland Institute and editor-in-chief of The City, an academic journal on faith, politics, and culture. He previously served as a speechwriter to U.S. Health and Human Service Secretary Tommy Thompson, former governor of Wisconsin, and as chief speechwriter for the U.S. Senator John Cornyn of Texas. An editor of multiple New York Times bestsellers, Domenech co-founded Red State, a prominent site described by National Journal as one of the most widely read conservative blogs on Capitol Hill. He writes a daily email, The Transom, which aggregates news and notes from around the web. And he co-hosts a popular center-right podcast, the Sam Adams Award-winning Coffee and Markets. In 1998, he was appointed by President Bill Clinton as a delegate to the White House Commission on Social Security. In 2009, he was selected as a journalism fellow by the Peter Jennings Project for Journalists and the Constitution. He currently lives with his wife in Virginia. Benjamin?
Thank you. I guess. I do work for the Heartland Institute. I hope that you'll go upstairs and, if you're not familiar with Heartland, and check out the booth and all the materials that are up there. There's a lot of really great stuff. Heartland is a libertarian think tank based here in Chicago, and we work with Republicans and Democrats because we don't believe that anybody has a monopoly on good ideas. I used to say that nobody has a monopoly on bad ideas, but I am proved wrong every day by Mr. Paul Krugman of the New York Times. I want to talk to you a little bit today about central planning, which is what Obamacare is. This is a line that not many people are familiar with, but it's from Ronald Reagan's book after he left office. And this is, him writing decades ago saying that we've strayed a great distance from our founding fathers' vision for America. They regarded the central government's responsibility as that of providing national security, protecting our democratic freedoms, limiting the government's intrusion in our lives, in sum, the protection of life, liberty, and the pursuit of happiness. They never envisioned vast agencies in Washington telling our farmers what to plant, our teachers what to teach, our industries what to build. The Constitution they wrote envisioned sovereign states, not mere administrative districts of the federal government. They believed in keeping government as close as possible to the people. Now that's 2 decades ago. And since then, we've come a pretty long way in terms of how much that has been rolled back. The warning that he was giving us at that point hasn't been heeded. And for too long, we've seen the scenario in Washington where politicians get there and they presume that because government can do something, government should do something. Obamacare is the fulfillment of this technocratic central planning approach, the view that government knows best. And we see this in the individual mandate, we see it in the redistributive subsidies, we see it in the price controls and the market takeovers, the bureaucratic rationing, and the dramatic expansion of our entitlement system. No matter what happens at the Supreme Court, I expect that this law is going to get reopened. It's going to get opened up again because it is, as Nina said, broken. It doesn't work even for the people who invented it. I was at an event recently in Washington where there was a conversation going on between all the people who still like to live under the illusion that it is working and the various Democratic Hill staffers who helped make that law a reality. And one of the staffers stood up and asked a question about why the individual mandate was so unpopular, because it makes so much sense. And he was sort of, walking through this. It makes so much sense, from a way to approach the market, the way to solve all these problems. Don't these people realize that it's something that we need to do? And he left too early, so I didn't get to pull him away, but I wanted to pull him aside and say, what you don't understand is that the people they're too stupid to understand. They think it's their money. The thing that I think we need to understand about central planning is that it always eventually runs into reality. When LBJ created Medicare and Medicaid, it was intended to be, it's sold as a safety net for the oldest among us and the poorest among us. Now, half century later, in terms of expansion, we have about 46 million people on Medicare. We have more than 51 million on Medicaid. And that's just the starting point for this new entitlement expansion. According to the latest estimates, and this is from the Medicare actuary and this is from CBO, this is not a partisan estimate in any way, by 2020, we'll add another 25 million Americans to Medicaid, another 15 million to Medicare, and another 21 million in subsidized coverage under Obamacare's exchanges. By 2020, That puts us at 157 million people who will have their health care subsidized in whole or in part by other taxpayers. Here in Illinois, 66% of the population would be eligible. We're talking about people who are families of four earning upwards of $92,000 a year. We're not talking about a safety net anymore. When we're talking about a safety net, we're not talking about 41% of the births in this country being paid for by Medicaid. I mean, these are astounding statistics, and they're indicative of the expansion of the entitlement state that we've seen. But this comes at the same time as we're seeing a shrinking workforce and the kinds of things that we see as the prelude decades ago in Greece. So at this point, we have to stand up and act. We have to reject this approach to central planning. And we're seeing this happen more and more at the state level because they don't have the luxury of being able to print their own money to get out of it. In Maine, Governor Paul LePage raised a lot of eyebrows recently when he pointed out that the state has more welfare recipients than it has taxpayers. In terms of the Medicaid issue, Jonathan already addressed the fact that it's the largest line item for most states, even though it pays doctors mere pennies on the dollar. And as Nina noted, there's a plethora of studies out there that show that it's actually better to be uninsured in some situations in terms of the outcomes that you receive. In Washington, D.C., there was a case a few years ago which really sort of dramatized this well. There was a young boy named Domenech Driver whose mother had Medicaid and who developed a toothache. She was between jobs, working part-time. There was a mix-up with the paperwork. It was very difficult for her to find a dentist anywhere in the area who accepted Medicaid because they underpay doctors, but they underpay dentists even more. Eventually, the toothache became more and more problematic. They finally brought him into a hospital, into an emergency room, which is where most Medicaid patients end up. It turned out that the tooth had formed an abscess. The abscess had gone into his brain. He had developed an infection. They rushed him in. They tried to save him, and he died on the operating table. An $80 tooth extraction a couple months earlier would have saved his life. And yet this is the program that President Obama is throwing 25 million more Americans into. Think about that for a second. This is what the false promise of central planning looks like. This is what you have when you have a scenario where politicians are willing to make all these promises because they know that they won't be in office when they actually have to deliver on them. It's the sort of thing that creates an established ghetto within society that people can't get off of. And when you're eligible for these subsidies, when you're eligible for these programs and you end up into them, the costs for getting out of them become higher and higher. That family of making $92,000 a year, they're in line to get 15 grand essentially from other federal taxpayers. I mean, think about that for a second and you understand how difficult it is to move out of that system. So what's the answer? If our course is this unsustainable, what are we supposed to do about it? I think that what we have to understand is that central planning fails whether it's from the right or it's from the left. It fails in part because the smart people who favor these approaches have no concept for how these things are going to be used by future administrations. It fails from the right because you leave tools behind that the left can use to ruin your idea or to make things worse or to use for their own ends. I think it's going to take, for that reason, a state-based movement of governors and of legislators, of activists, of people who are engaged with what's going on to really come from the ground up and solve these problems. And we've already seen that across the country. Governor Jindal is a perfect example of this. Governor Scott in Florida is doing some amazing things. Governor Jeb Bush's approach to reforming Medicaid, which is one that people are just starting to understand in terms of how much of an impact it's been able to have, is one that has to come up from the state level and has to be applied in Washington if we're going to make any difference. I think that a movement that goes to Washington to shift power back to where it belongs with the people is something that is essential if we're going to survive this. But I think that the thing that we need to understand most is that we can't just satisfy this situation by fixing holes in the safety net. We need to break the bars of that ghetto. Ronald Reagan's mission when it came to welfare was welfare's purpose should be to eliminate as far as possible the need for its own existence. That's the approach that we need to have if these things are really going to be a safety net. I think that as this leadership rises from the state level, America can ultimately attain the entitlement system that it does deserve, which is where permanent redistribution is banished, personal responsibility is renewed, and competition, transparency, and innovation thrive. Under the policies of the central planners, the fruits of the pursuit of happiness are to be parceled out by self-appointed elites in Washington to those who they deem worthy. The American people deserve a government that returns to its original mission as our founders intended. America didn't become the shining city on the hill because of the entitlement state, because of redistributing wealth, because of spreading the money around. One of my favorite presidents is Calvin Coolidge, and I can't ever talk without sharing a line of his that he said in one of his final speeches as president. He was asked by a journalist before the speech about what his intention was when he got into government work, and he answered it in the speech by saying, "I want the people of America to be able to work less for the government and more for themselves. I want them to have the rewards of their own industry. This is the chief meaning of freedom." That's what's at stake when it comes to Obamacare. That's what is at stake when it comes to the expansion of the entitlement state. Whether your children are going to grow up in a society that is content to live with a managed decline, content to live on these lies about the future, content to live knowing that we'll eventually run into the problems of Greece, or if we take a different path, a different direction, and we have to start now.